You know, it's a very challenging thing to know, and they've had record numbers, and unfortunately what we're starting to see are what we call the lag indicators, you know, the hospitalizations and the deaths now starting to increase, even though many of the cases are in younger people. So that's very concerning. And yes, you know, I don't believe that there's any reason that we would expect to be able to safely have visitors, people who are here as tourists, in the coming weeks or months. I'm happy it's going till August, and we'll need to, of course, make sure that we watch carefully and monitor what's going on. There are a lot of people who have connections across our borders, so we are looking at how do we make sure if people need to come into Canada, it can be done safely. And we need to look at people like students and foreign students who contribute to our research programs in our universities and other things. And how can that, other people who are coming across our borders both ways, and how can that be done safely? And to me, right now, that means there's a 14-day quarantine period, no exceptions, because that's how we keep our communities and we keep people safe. Because if they are in our care, or at least being monitored during their quarantine period, we can get them the care they need should they become ill. So there's a dual purpose for that. So we do need to look at special populations, I think, over the coming months, but I don't see anything changing in terms of tourists and visitors coming, especially short-term visitors.
Yeah, I'd just say that August 21st, and we're very appreciative of the work of the federal government in extending the ban on visitors both ways with the American government, and obviously it's important both ways too. This is not just a restriction on American tourists or American visitors coming here, but a restriction on Canadians visiting the United States. That's part of the agreement, and I think that's an important part of the agreement. If you remember the previous presentations that Dr. Henry has made around modeling and around the trajectory of COVID-19 in British Columbia. And also note that, of course, the situation is very serious in the United States. There are outstanding people involved in attempting to control COVID-19 in the United States, and a huge commitment by really hundreds of millions of people. And so we're thinking of them, and we are on their side. We want them to succeed. And I'd also note that there are other countries in the world, because this pandemic has not got better, didn't get better in June around the world. There are other countries in the world with travel to British Columbia and travel to Canada that are facing significant challenges, which have record day of new cases after record day of new cases. And so we have to continue to be vigilant. And finally, we in no way, in absolutely no way, can be smug about this question. This is a worldwide pandemic, and as long as it's a worldwide pandemic, we are at risk in British Columbia, and we have to continue to follow the advice, the guidance, and in some cases the rules that have been presented by public health, by Dr. Henry, by medical health officers around BC. It's critically important to do that so that we not just have our situation here that may be better than other places, but that we maintain it over time in the weeks and months to come.
Do you have a follow-up, Keith?
Yes, just in regards to, again, to the border, anecdotally, we keep getting anecdotes from people saying, I've seen all these American license plates. Based on your knowledge of the statistics, do you think that is actually correct, that we're getting people across the border improperly, or is the system working as it should?
You know, I think it's a bit of both. There are certainly people who are coming across the border, and we have to remember Canadians can come in, even Canadians who are living in the United States right now. There's no restriction on Canadians coming home, but they need to self-isolate for that 14-day period. And we have been working here in BC to make sure everybody has an appropriate plan, and CBSA has taken that on and is monitoring people. So we can't assume we know the story of the person who's driving a car with a license plate from the United States. They may have been here for a long time. They may have been here and done their incubation period in isolation and are now safe to be out with us as well. So I think we need to be charitable, and we need to understand that everybody has a story, and there are reasons that people need to come back home to care for people, to care for family, and for many other reasons. And I mean, quite frankly, with what's going on in the U.S., if you had the ability to come home to Canada, I know many people have been taking that opportunity. Yeah, and it is not just flights from the U.S., I will note. There's flights from other countries, but there's also internal flights. And we've had people who were actually sick on a flight coming in from Toronto, from other parts of Canada. So yes, these are things that cause me great consternation. The airlines, all the airlines need to have processes in place to screen out people, but we need to be honest about it. And part of that means if we are not feeling well, we need to have the ability to postpone or change our flights. Those are important things. The other important thing that we need to have is people making sure that they are cleaning their hands, wearing masks, all of those important things, but they stay home if they're ill. And from the airline perspective, making sure we have flexible policies and making sure we have appropriate contact information. One of the most challenging things we do is trying to get flight manifests a couple of days later when we recognize somebody who might be ill. And the type of information that's on those flight manifests is often not very helpful in trying to follow up people, which is one of the reasons why we also post things publicly. So to be able to more efficiently identify people that are within rows of somebody who develops symptoms after a flight, or even if they had symptoms on a flight, those are things that would be really helpful for us.